Hello, my name is Jānis Zaržeckis. I'm a surgeon. My specialty is plastic, reconstructive and hand surgery. I'm residing and practicing in Riga, Latvia, Ādaži Private Hospital, which is just half an hour drive from center of Riga. And today I would like to tell you about the disease regarding the ulnar nerve pathology and injuries, and how we can treat and how we help those patients. So the ulnar nerve is the nerve who is responsible for the patient's sensitivity of 4th and 5th fingers, the half of 4 and totally the 4th and 5th fingers. And this is the sensory branches of this nerve, and nerve supplies with motoric branches, the small intrinsic muscles and motoric muscles who are responsible for precise movements of the hand and makes the hand alive and able to perform daily activities with precision and makes the hand useful. In the case, if the nerve is somehow damaged, the patient comes to my office with complaints that it's tingling in the 5th and 4th finger, sensitivity lost, and if the disease starts and with the time, if the motoric branches are affected, then his ability to perform the precise movements. And you can see the hand is like clumsy, and if, for instance, in the severe cases, if I give to my patient the pencil and let him handle in between 5th and 4th fingers, he is unable to do so, and the pen falls out, and that means the motoric branch is affected as well. So, to determine where the nerve is damaged, I suggest to my patients to do the neuroconduction research before the surgery, because the two places where most commonly the nerve is affected is in a cubital channel or the Guillon's channel, which in the wrist. But most common, this is a cubital channel, and to know where to perform this, the release of the nerve surgery, we got to have this examination. If we have all the data where the nerve is damaged, the patient can come to Ādaži, to our private hospital. We can perform the nerve release procedure. And it's possible to do within a local anesthesia. We give the block of this nerve and the local, turn it completely numb. Then we open up the nerve, we make a good space for the nerve release of the nerve, and then we close the wound, and then the patient can continue since the nerve is released, he can continue the further treatment on outpatient basis, and there is no need to stay in a hospital. The wound heals pretty fast in 1 week up to 10 days, let's say in 10 days time, and then the stitches got to be removed, and then the nerve is not compressed anymore, and it's with good blood supply, and now recovery of the nerve starts. Fairly, I got to tell, normally is never the fast success of this surgery, because it really takes a time for regeneration of the nerve, and it depends how long it's gonna be damaged. Then it takes time, because patient can continue the daily activities. It can start a little training of the muscles, and by the time goes by, the patient can start returning back of his sensitivity, and there is no more pain and tingling in those fingers. The first symptoms tell that a nerve starts his recovery, and sometimes it could take a pretty long time, up to 3-6 months time, but then the patient is unable to start to resume his precise activities in the hands, and sensitivity slowly returns back to those fingers, and hand is useful, and in that means that's a good way how to improve the patient's life quality. So, if you see some symptoms I already described, you are more than welcome to come to the clinic to have the consultation, to have the examination, and in the case you need, we can provide the surgical treatment to improve your hand operational quality and in the same time the quality of your life. Thank you so much for watching and listening, and goodbye.